Hello, and welcome to COVID or pandemic fatigue. What is it and what can we do to manage it? I'm Stephanie Mucha, the Director of Publications and Outreach at Access to Care, and I'm very excited to share this much needed event with you. Today's informational interview is sponsored by the Cook County Department of Public Health and Access to Care. We welcome Dr. Rachel Rubin, who is the Senior Medical Officer and co-lead at the Cook County Department of Public Health. Dr. Rubin will be interviewed by Dr. Maurice who is our immediate past chair of Access to Care's Board of Directors. After our formal interview, we will be asking the experts some questions about COVID fatigue that we've heard from you, our populations, and our communities. And from here, I'll give it over to Dr. Lemon.
Thanks, Stephanie, and thank you, Dr. Rubin, for agreeing to participate. On behalf of Access to Care, our clients and physicians, I want to thank you and all of the Department of Public Health for what they do. We know that it's an incredible challenge right now, and we're now in month 6, 7, 8 of this pandemic, so it has gone on what seems like forever, a lifetime. So with the theme of today's discussion, though, we're going to really focus on this pandemic fatigue, COVID-19 fatigue. So what is it exactly in your mind, or what do you and your colleagues at the Cook County Department of Public Health see as the issue here?
Yeah, I see it almost sort of one issue that sort of leads to behavior changes that are not always so helpful. So I think what pandemic fatigue is, and what it's been articulated as, is sort of what's a consequence of us wrestling with sort of intense emotions and difficulties in our day-to-day lives. We feel sort of drained of energy and burnt out with relating to dealing with sort of a new reality of COVID that creates restrictions in our movements, that creates enormous amounts of pressure for many people, such as economic difficulties, childcare problems, educational problems with children, uncertainty with food insecurity, and just emotional upheaval. And what that leads to is a variety of symptoms, which we'll talk about. But what's even as equally concerning is that people are getting tired of adhering to the guidance that's necessary to keep us safe, like wearing masks all the time when you're with other people, and the physical distancing that's required, the constantly being careful about hand hygiene. So these kinds of practices that we know do keep us safe are harder and harder to adhere to. So that's part of a consequence of this fatigue of just dealing with, emotionally a very uncertain times and day-to-day struggles of getting along.
Yeah, so I think we have a lot of our clients live with difficult economic, financial circumstances. And so I think the question is, how do they recognize this in themselves or in their loved ones? I mean, what are the things that would point out to them, oh my gosh, we're getting burned out, we're getting, overcome here, and maybe we need some help. So what are the things that particularly would kind of trigger somebody's thoughts about, this is something they really need to consider?
Sure. I think that it's the kind of symptoms that you would tend to expect when you're feeling sort of anxious. So fear, feeling fearful, afraid to go out, anxiety, loneliness, feeling disconnected, hopeless about life or the future, feeling frustrated and irritable. And these might be feelings that we all have at times, some people more than others. But if you notice that that's becoming more common, if you're constantly sort of ruminating on things, that these are warning signs. If your sleep is being disturbed, especially. Some people are sleeping more than usual, but many of us are having disruptive sleep, waking up a lot, difficulty getting to sleep. And these are not things that necessarily have been long-standing. So these are things that are new. So that's another thing to pay attention to. You're muted.
There. We know that people that have pre-existing conditions, chronic illnesses, that are at more risk for complications of the disease. What kind of conditions might predispose people to this kind of pandemic fatigue, or what kind of difficulties might make it more difficult for people around this?
Well, certainly people that already have some issues with anxiety and irritability, that this might will become more pronounced. I find that it's especially because I'm the parent of a young adult, a college student, that young people, especially that, you know, the age of say 18, 19, 20 and younger, are having especially difficult times because it's part of our development as you know, physical development, emotional development, is that we're social beings. That's part of the human condition. And where that's being curtailed,
Mhm.
where the only interaction or significant interaction you have with people is over a Zoom chat, or through other social media methods, and you're not seeing people face to face, you're not interacting with classmates in school, that's become especially difficult. And we've been seeing more issues of mental health issues or more anxiety, especially in young people.
Yeah. How about, I mean, you mentioned mental health issues. How about people that have substance abuse problems? Is this a risk for them?
It certainly is. We've been seeing a rise in substance abuse, at least in terms of deaths. We've been seeing a rise in opioid related deaths. We've been seeing a rise in suicide, or in accidental overdoses, and alcoholism has become more pronounced. In looking at the trends, that there really has been creeping up during this time of COVID.
Yeah. So let's say I'm a person who is having these feelings, or maybe I have depression and things have gotten worse, or maybe I'm drinking more than I normally would. What are the best ways to kind of manage these, or what are the sources of help that are out there that could help me or a family member I recognize is struggling with this?
Well, sure. I think that there are a lot of things that we can do as individuals and as families that are helpful. Certainly, if things feel like you're totally out of control and that you just can't seem to handle your feelings, your emotions, you feel extremely depressed or anxious, then please reach out for professional help. There are national hotlines. Reach out to your physician. It's not something to be ashamed of. But for people who may not be in that extreme of a situation, or they see them maybe growing towards that, there are certainly some strategies that can be done. One is to take care of your body. You know, get enough sleep, have a nutritious diet, put yourself on a regular routine. If you're working or studying from home, that doesn't mean stay in your PJs all day long. Get up, have a regular routine. Get up, have breakfast, get dressed, take a shower, get dressed, and take breaks during the day, right? If you're sitting down in front of Zoom meetings like I'm doing all day long, the idea is to get up and move around. Try to get some exercise every day, even if it just means taking a walk. And you know, especially as long as the weather is conducive, go outside and take a walk. Have your mask on, but go outside and take a walk.
Yeah.
So try to keep some sort of physical activity every day. Also, a couple of other things that I found interesting in investigating this topic was that try to limit your news intake. You know, we are being flooded over and over again with very difficult, hard to listen to messages. Not only the messages about ways of keeping ourselves safe, but the difficult stories of people dying, or listening to the statistics, or reading the statistics in the newspaper or on social media. Take a break from it. Maybe only listen to the news every other day, or give yourself maybe once a day that you look at it, maybe for a period of time, unless you have a job like mine where I have to be looking at it, to limit that kind of intake of that kind of news consumption. Another thing too is think about what things help you calm down that make you feel good. watch a comedy on TV. Don't watch those dark, deep dramas that many of us like to watch. So, turn on The Simpsons or turn on, a comedy to watch, or stream a romantic comedy on YouTube. Um, Breathing exercises are good. Yoga's good. And another thing too is to connect with other people, even if it is virtually. That's not
Mhm.
ideal, but it's still important. And that's why we're saying in the health department, we don't want people to social distance. We want people to physically distance. We want people to feel socially connected.
Yeah.
So connect with your family, connect with your friends. Actually,
Yeah.
pick up the phone and talk to somebody instead
Yeah.
of constantly texting, which is what I'm constantly doing with my daughter. And
Yeah.
sometimes I just call her and I call her until she picks up. I said, I just want to hear your voice. That makes a big difference to have that kind of connection with your children, with your parents, with your
Yeah.
friends, with your family. So have some sort of physical, if not actually physically close, but a physically distanced connection with people. So you have a social and intimate connection with people. Another thing too that I saw that was interesting is maybe start writing letters again. It's really fun. You're cooped up at home that you actually get a letter or a nice card from somebody, from a friend saying, just thinking about you. Those things really boost you. So it's also a matter of thinking about other people and thinking about other people and how they're feeling and that we're all in this together.
So a question I have is we're now heading through the fall into winter. How do we expect that the onset of colder weather here will make it worse, make it, but what do you think is going to be the effect of that on this issue?
Yeah, I think there are a couple of things that might happen in the winter. We're worried about the interplay of influenza with COVID illness. Um, we're hoping that we're going to have a lighter than usual flu season. The flu season tends to occur in the southern hemisphere before the northern, so we can see what's happening in Australia or in South America. And they have had lighter flu seasons than we have. And that could be because people have been wearing masks and have been staying inside. So on that level, we don't want the interaction of flu and COVID because people that are higher risk for complications from COVID, if they also get the flu on top of COVID, are really more likely to get serious complications from COVID and vice versa, and more complications from the flu. So we're worried about that interaction. The other thing too is that we're going to be indoors much more, and outdoors we know you're less likely to get COVID if you're outdoors and physically distancing and wearing a mask when you are with other people in groups outdoors. But indoors is when it can spread much more easily because you don't have the same amount of air exchange. So we're going to be indoors more, and we have to be indoors, but we're going to have to be only with our households generally indoors is what's expected. But if people are getting fatigued with doing that, and people are going to be together indoors in close situations, then we could see more COVID. It doesn't seem to be a seasonal kind of virus where we see decreases in the summer and increases in the fall and winter. It seems to be happening all year round. And so our behavior in different seasons can create a difference in how much the disease spreads.
Yeah, according to some, they thought that it would go away in the summer, but that didn't happen.
Right,
Uh,
didn't happen.
So, you've talked about all these things in the winter. You've talked about the masks. I know the distancing, the hand washing, other things. I mean, are there any of these that need to be more of a priority than others, or we really just have to do them all still?
I think in many ways we have to do them all. I mean, not that I'm saying people shouldn't hand wash, but we've been finding in the latest literature is that the way of getting COVID, it's not as likely to get it from touching a surface where somebody had coughed and their secretions had dried on the surface, and then you touch it and then touch your face, which is typically how we say the common cold and influenza and other kinds of airborne illnesses can be spread. COVID, we know, is spread through the air. So the way we stop that is through maintaining as wide a distance between us as we can, because then it can only travel so far through the air because the droplets eventually drop. And obviously to wear masks and to remember that the mask that we wear, whether it's a surgical mask or a layered cloth mask, not just one layer, they're saying 2 or 3 layers, it captures most of my cough or most of my sneeze so that I won't be infecting you, at least not as easily. But if somebody coughs or sneezes right in front of me, even if I have a mask on, those viral particles can penetrate that mask and can potentially infect me. So the idea is we all have to be wearing masks because my masking might protect you, and when you mask, you'll protect
Yeah.
me. So we really need to mask, and maybe that's the most important of it all. But also, people shouldn't be clustered together. They shouldn't feel that if they have a mask on, it's safe to be very close to each other.
Yeah, I mean, something that's come up a lot is this question about masks. I mean, people wear them, but can you wash them? You know, how often do you need to change them? Are they as good a month later as they are when you start? I mean, what are kind of what should people know about you know the length of time a mask is good for, what they need to do when it's
Right.
kind of been used for a
Well,
while?
Well, if you're wearing a surgical mask like this, which I have right here on my desk, which I put on when I leave my office, those I should change every day. Um, they can trap the secretions, and then also, I mean, they get nasty. Come on, you want to change that every day if you can. If you're using cloth masks, those should be well manufactured, not just a single layer. They're saying that cotton is good. These gaiters are not so good because they don't fit as tightly and they tend to be sort of more single layer or they're a synthetic. To wear a 2 or 3 layer mask that at least is cotton or a cotton blend, and they should be washed every day. So the idea is just to have 2 or 3 of them so that you can wash them. And of
Uh-huh.
course, when they begin to get too stretchy, that the ear handles have stretched out, if you find that they're beginning to get frayed or that they're don't feel as strong, then that's the time to discard them. And they can last for quite a while, but you do have to wash them every day. In other words, wear a new mask every day, whether it's a cloth mask or whether it's a surgical mask.
Okay. All right. Well, so how long do we expect this to go on for?
Wow.
What do you think?
What do I think? What I think is that once we get a vaccine and people take the vaccination, right? Dr. Fauci has said uh, that vaccine isn't the issue, it's vaccination. So people have to be willing to accept the vaccination. And when we get sufficient number of people vaccinated, I think then we can begin to go back towards, I think we're still going to have a new normal for a while, but to at least allow a certain amount of increased social interaction. But I think that that's going to take a couple of years because we have to have a vaccine out there. We get everybody vaccinated or as many as we can. And the goal is to get at least 80% of the population vaccinated because then we get so-called herd immunity, which means that the virus, enough people are immune to the virus that the virus isn't circulating in the community so much. And then the
Yeah.
other 20% that are not vaccinated or not immune are less likely to get the virus because it's not there. It's not sort of floating around between positive people and being uh, carried to another host, another person. But we usually need to have a vaccination in place for a couple of years in a row, a couple of seasons of vaccine for us to begin to get a significant level of control. Does this mean that if we get an initial supply of vaccine, maybe in the late fall, early winter, and then we get more rolled out throughout the next year, that won't have an effect? I think it will. I think it will make a difference as soon as we begin to see vaccination uptake in our communities. We will see a change probably fairly quickly, but not to the levels where it can be ignored or where we just consider this is just something that will be with us on occasion. I think we're going to have to be vigilant for at least another couple of years.
Wow, that's sobering to think about that.
Yes, yeah.
Um, well, you know, I know there are a lot of our clients and a lot of other people have probably already had the illness. So if they've had it, can they sort of take off the mask because they're not going to get it again? Or if they're not infectious, I know that wouldn't happen right away, but let's say it's been a couple weeks since they had the illness or they had a positive test. What about their behavior should or shouldn't change after they've had a positive test?
After they've had a positive test and their symptoms are basically gone, so they've gone through the isolation period of 10 days minimum, and they no longer have a fever and their other symptoms are improving or almost gone, it's highly unlikely that they are going to be able to get it again and they can no longer infect anybody else. But how long that immunity lasts, we don't know. We think that it's probably a matter of several months, but we already are beginning to see in very unusual but occasional cases some reinfection. So somebody that had the virus 3 or 4 months ago having and have tested negative, and then they come back and they're testing positive again, and have symptoms again. So it is appearing that it is a new infection. And I imagine that also there's certain what we call host responses, meaning an individual person's ability to maintain those antibody levels, an individual person's immunity, how strong their immune system is, might vary from person to person. So one person's immunity may last a little longer than another. Also, we don't know yet how easily the virus mutates. The reason we get a new flu vaccine every year is because the influenza virus mutates and it changes a little bit every year. So we have to get a new vaccination that's slightly different and has slightly different components to it so that it will work the next year. We don't know if that's going to be happening with COVID. So that once you get a vaccination, we don't even know how long your immunity is going to last. And we imagine that you're probably going to have to need it every year. So then for somebody that actually has the illness, we don't really know how long their immunity is going to last. We think it's a matter of a few months, but we don't really know how long.
Yeah. Hmm. Well, if I had a positive test or if I was testing positive, we've heard about this contact tracing that the Cook County Department of Public Health does. What should or what ought to happen if I become positive or I find out I'm positive? Should somebody contact me? Should I contact somebody? I mean, what should I do as a person who gets a positive test?
Right. Well, first of all, if you get a positive test, the first thing you should do, and hopefully you've already been doing this if you're not feeling well and you went to get a test because you weren't feeling well, not if you're getting a test just because you want to know or because you were exposed to somebody. But if you got a test because you weren't feeling well, I would suggest that you isolate yourself from the time that you are feeling unwell, even if you then go in with a mask on to get a test. But from the time that you're positive, you need to be in isolation for 10 days. And that 10 days really starts from the time you started to feel ill, or if you're not feeling that sick, from the time of your test for a good 10 days. And what isolation means is staying away from everybody else in your household, hopefully sleeping in your own bedroom. If you have to leave that isolated space, you have a mask on, you have gloves on, or you have other people that are able to clean the space. You really have to keep yourself away from every other person, unless they happen to be positive with you, for a good 10 days, where you then have no fever for 24 hours and your other symptoms are basically almost gone. So that's something that you need to do. Hopefully you will also get a call from the health department, because we get pushed out to us in our jurisdiction. Anybody that has a positive test, if their test was done in an accredited lab, if the analysis was done in an accredited lab, whether it's a commercial lab, hospital lab, clinic lab, because those lab systems are electronically connected to the state database, and those positive tests are pushed out to our health department through an electronic surveillance system. So we know who's positive, and we call you up once we have enough staff in line to be able to call everybody. Right now, we're prioritizing who we call. We're calling young people right now for sure, because of the issues we're dealing with in not wanting to have spread through schools. And we were also focusing on long-term care facilities, meaning nursing homes and such, because those are the individuals who are getting very sick and dying from COVID. So we will definitely call those folks. But even if you don't get a call, but hopefully you will get a call, and that's what contact tracing is all about. What we're going to do is we're going to call you. We're going to make sure you understand what it means to isolate. And we're going to ask you who you were in contact with from a couple of days before you felt yourself getting sick up until the time you were in isolation. We want to know everybody who you were in close contact with. So that means anybody you were with for more than 15 minutes. So a coworker that even if you had masks on, but you were working next to all day long. Certainly anybody in your immediate household. We want to know everybody who it is, and it's not because we're reporting anybody. All of this is kept within the private public health system. So the idea is that we want to then reach out to those contacts, and that's why it's called contact tracing. We then will call those contacts if they're not in that immediate household. We have other people, or we will in addition call those contacts, and we'll interview those contacts in the same way. And we'll say, you don't need to isolate, but you need to quarantine. And what quarantine means is you don't necessarily have to lock yourself up in a bedroom, but we want you to stay home, to wear a mask if you're around other people in the house, and don't go out. Have other people deliver groceries for you. Basically, try to keep yourself in your home and minimize the movements. If you're going out to see the doctor, and get yourself tested as well, but wait for 5 days at least since you were last in contact with the person who's sick. So you're a contact, you're not sick. We want to keep you safe and we want to keep you well. And we also don't want you infecting other people if you do begin to get sick. So we talked to you about quarantine, and that's for 2 weeks. Even if you go out after 5 or 6 days and you get that test and your test comes back negative, you still have to stay inside for 14 days because you can develop symptoms and you can develop the infection up to about 14 days from the last time you were in contact with somebody who was sick. So that's what we do in contact tracing. We call you up and we talk to you. We make sure you know about isolation, about quarantine. We also want to know what other needs you have. What other issues are going on that might make it difficult for you to isolate or quarantine? Maybe you live in a home that has 2 bedrooms and there are 4 of you or 5 of you in that house. And so how can you easily isolate? How can you easily quarantine? Do you need help with what? And we have an alternative housing program where we can have you or loved ones potentially in a hotel for a period of a few days. Do you need help with that grocery delivery? Do you need help with childcare? Do you need help with transportation to doctor's appointments? So things like that that are necessary to keep you in that isolation and quarantine. So we have a whole program involved with trying to develop and provide wraparound services for people if it's necessary. So that's very important, and a very important part of the program as well.
Well, I think we could go on for a long time here. Really, I mean, there's so much information that's, I think, useful to our clients and our physicians and other people as well. But I want to sort of ask Stephanie has accumulated a few questions from other sources and see if she has any to put to you. Go ahead, Stephanie.
Sure. Thank you so much. That was very informative. I think you touched on a lot of the questions that we've already had from our members and some other folks in the community. But I think just to recap, we do get questions about masks. How often do we wash them? So I think what you said, Dr. Rubin, was the light blue surgical masks. Those are supposed to be kind of a one-time use or one-day use. They get kind of gross. Throw them out. Those are disposable. The ones that we should be using and we should be washing, and I understand you could wash them in a washing machine or a hand wash, let them dry with a good soap. Multi-layer cotton masks are more protective. Is that correct?
Yes.
Okay. It sounds like we need to still stay the course. I think we were hoping for the summer months it would be gone. Well, it's not. And I think in fall we were hoping it would go away, and maybe even when winter comes that it would go away, but we really do need to stay the course. And I think that's sort of the point of what we were talking about today. The part of the fatigue is kind of getting burned out from all of this, all of the overflow of information. But it does sound like the more we stick with the public health guidelines, the sooner this will become a more manageable situation for us. And then contact tracing, I was called contact tracing. I think that was something I didn't know, that you offer other services with that. I think some people get a little, what are you calling me and asking me what store I was at and who I was with, may get a little defensive about asking those questions. But I think one is for the common good so that doctors and scientists can learn more about how you contracted COVID-19 and to hopefully prevent others. But I think the second part, which I think is important, and we'll make sure at Access to Care to share more with our members, is answering the phone and answering those questions can also help you with some things that you might be struggling with. Like you said, grandma and grandpa and aunts and uncles and cousins all living in the same house. Well, we're just gonna have ping pong COVID going on if you can't get out, or if you have children in the house and you need help, you can't get out to the store for whatever reason, that there's help for that. And that's wonderful to know. And we appreciate all the services that are offered in the community. One question, and since we're sort of passing barbecue season, let's just call it, in Chicago, and we are going to be getting pretty quickly into Halloween and Thanksgiving, Christmas, Hanukkah, etc. seasons, we're going to want to gather in our families. And I think there was some confusion earlier on. Well, if I have a birthday party, but it's all of my family, I should be okay, right? What about when holidays are coming up? Are we going to have to stay the course? Are we going to have to cut back on the gatherings, even especially if the weather is cold? Okay.
Yeah. Well, one thing, first of all, about Halloween, there is some state guidance out there about Halloween, and Halloween is really fun. But, in my neighborhood, they have this one whole block, one side and then the other, that is sort of blocked off. And that's where all the kids, when my daughter was younger, that we would go for trick or treating. And my God, people were packed there like sardines. We would be going, and it was really a lot of fun. But no, that can't be done this year.
Okay.
And there's specific guidance for that. I would suggest people go to the state of Illinois IDPH website and look at it. But what it basically says is that you've got to wear a regular mask. So you've got to wear a surgical mask, or you've got to wear a cloth mask. The ghoul mask, the ghost mask, the Spider-Man mask is not going to do the trick. You have to have a protective mask on underneath your costume. And the idea is only go out with your immediate household, or maybe with a close family that you have been interacting with and you have sort of created a small community with. And the idea is for people that are putting the candy out for trick or treating, they should put out, if they can, like a bowl of candy that's all individually wrapped. And that whatever somebody takes home, wash your hands before you partake of the candy, so that is all clean. Also, so that you are not contaminating yourself. Also, no haunted houses. Haunted houses are really off the table this year, right? Because you bump into people, you don't know where you're going. I mean, the whole idea is you get very jam-packed together in these sort of fun houses. So that's sort of off the table. But there are safe ways of trying to do trick-or-treating. And then as the other holidays come up, it's really hard. I have elderly parents that live in sort of an independent living. We get together for the holidays. We're not going to be able to do that. I can't even take them out to a restaurant, which is sometimes what we do. We can't do that. It's not safe for them to be in that environment. It's not safe for me to be in that environment. And so one thing that I found an interesting suggestion that I might do with some friends is that we thought to have, I don't know if you guys remember what we used to call progressive dinners, where people would sort of go from one house to another and there would be a different dish that somebody would prepare at each house. Mm-hmm. So what we're thinking of doing is we're going to have a big meal, and there's be like 5 or 6 families. And what we're going to do is each of us is going to make a dish, and enough for everybody. But then we're going to drive to people's homes and leave their portion outside their house, right? So by the end of the day, by the end of the evening, we will all have received a meal. And then we can get on Zoom and then we can share that meal together. So this is the way we sort of share in a collective kind of family or friend get together. But it still has to be done at a distance unless you're doing it with your immediate family.
Okay. As my very wise 11-year-old said, whose birthday's coming, we might not be able to have the birthday like we usually have, but this is so we could have many more birthdays in the future, including grandma and grandpa. And I thought that was wise. It's
Very
not
wise.
ideal. It's not ideal, but like you said, Dr. Rubin, it's so we can have future events and future celebrations, and it's not safe, especially for elderly. So we'll have to stay the course on that and just modify it and make it fun in new ways. And then I think just in general, the testing, people, we get a lot of questions. Where should I go? When should I get it? We see a lot of free testing, but only if you are asymptomatic, or meaning you're without symptoms. So if you are thinking maybe you got exposed, should you get a test? Or if you're feeling badly, what's the two different kind of routes to get tested and why?
Yeah, well, if certainly if you're feeling badly, even if you don't think that you were exposed to anybody, go and get a test. And if you have a primary care doctor, please call the doctor or call the doctor's office and see if they offer COVID testing or where they might refer you to go. If that isn't really possible or there aren't those options, the state of Illinois does run free testing sites, and they're drive-through or walk-in. Generally, you can just drive through, you open your car window, they swab your nose, and it's not that deep nasopharyngeal swab, the brain biopsy swab. It's just a nasal swab, and then you're on your way. And then you will get a phone call with your results. There are 3 or 4 of them throughout Cook County, but they have them throughout the state, and the state of Illinois has a map on their webpage, IDPH, Illinois Department of Public Health webpage, that has a map, and it has a whole listing of places you can go. And it also lists there all of the testing sites that we know of. It's not all of them, but all of them that we know of that the state has put together on that webpage. And you can look on there, and each of them will tell you, and you can look at it by zip code, or you can look on the map and you can zoom into your neighborhood, and you can see if there's a testing site near you. And each of them, unfortunately, have different criteria. Some you have to be a member of that particular health network. Others, you have to be symptomatic. Others have age requirements, though more and more are getting more open to taking anybody that just wants to have a test.
Mhm.
I certainly would hope that most of these sites at least are opening up to anybody that feels they've been exposed, even if they're not feeling sick. Because if you've been exposed, wait 5 to 7 days, 5 to 8 days after that exposure. In the meantime, be very careful, and then go ahead and be tested. It's very important to be tested if you think that you've been exposed. I know that that's gone back and forth with the CDC saying otherwise, but we in the state and the county, we recommend that you go ahead and get tested if you've been a close contact. And certainly if you have symptoms, please go and get tested. I had a patient last week who I insisted she go in and get tested. She said she's been staying at home the entire time. She has other chronic diseases, illnesses, and she said she's only been interacting with one close friend of hers. Sure enough, she was positive.
Wow.
Right? And that was good to know. It was important to know about that. So if you're symptomatic, please go get tested. And in most instances, if you're symptomatic, places will take you. And also, it's supposed to be free. You shouldn't be having to pay anything up front. And if you get a bill, you should complain about it, because testing is free for everybody. Insurance can be charged. If you have insurance, Medicare, Medicaid, private insurance, it can be charged, but you should not be charged anything if you don't have any of those resources.
Okay, that's great. And I know with Access to Care members, we have been giving them information on how to receive those tests free. We know that we've been sharing resources from the county and also from the state. And we do have so many wonderful community groups in Rubin, Cook County, and in the city who are sharing, a social service agency or a church or a local scout group would put together, a COVID and flu shot option and lots of
Exactly.
health fairs for a different reason, if you will. And every time we see something like that again throughout suburban Cook County and otherwise, we've been able to share that. So we thank you for getting that information, and we're happy to keep sharing that. I believe those are all the questions I had for now. I did, when we do this to our members and the public, we're going to ask them if they have any additional questions, and I hope you would all be open to answering those. If anybody had any final comments, let's do that now. Or if not, I'm going to wrap up with just giving some options for people. If you're feeling the COVID fatigue, feeling mentally drained, if you're feeling emotionally drained, if you have physical symptoms, I think what we're trying to say is there is help out there. Doctors, community contact services, there are people out there that can help you. And we're going to give you a lot of opportunities and options to reach out to those people. We're all in this together. And I think this has been, I don't know, I say Chicago and Chicagoland is a great place to get sick because we have a lot of the best doctors and medical facilities and everything. But more than ever, I think the camaraderie and everybody coming together to help each other out has been, I know for me, very humbling. And we have been trying to share that. So we will be letting people know if you need help, mental, emotional, physical, or otherwise. We are here. Dr. Rubin and her staff are here. We are here to help others. So is there any final comments from you, Dr. Rubin or Dr. Lemon?
No, I just want to again thank Dr. Rubin for participating. I think what's abundantly clear is that we've got to try and maintain the kind of vigilance that we've had to now. It's going to be a while, and we need to find some sources of support to help us through this because we can't slack up now.
Okay, so we thank you again, Dr. Rubin from the Cook County Department of Health, Dr. Maurice Lemon, our immediate past board chair from Access to Care. If we have any additional questions or need further information, I'm just going to give the Cook County Department of Public Health the COVID-19 hotline. You could reach them at 708-633-3319, and the staff is available to help Monday through Friday from 9 a.m. to 4 p.m. Access to Care Resource Desk. We speak Spanish as well. We're available at 708-531-0680, and we're here Monday through Friday from 9 to 5. I've also put some additional information under the video with email addresses, websites, anything you could possibly imagine for whatever you need from the county, from the state, from Access to Care, neighborhoods, etc. And with that, I'm going to sign off and say thank you so much. Wear your mask, be safe, and thank you.
Thank you.